This is a topic even hospitals approach cautiously. Perhaps at this very moment, many of you are taking vitamin C daily. But here's the issue. Most people are taking it incorrectly. If you've ever experienced stomach discomfort or diarrhea from taking it just once a day on an empty stomach before bed, that was your body sending you a signal. I'm Dr. Sungchul Park, an internal medicine physician who has spent the last 40 years caring for patients. I've walked alongside them in their battles against illness. Even now, I see patients every day from 8 a.m. to 5 p.m. On weekends, I walk for 3 hours and tend to my garden. People are surprised. At your age, you're still seeing patients, they ask. My answer is always simple. The body is the result of your habits. The greatest secret I've come to understand in my 40 years as a doctor is this. Health doesn't come from special treatments or medications. It begins with small daily habits. And today, I'd like to talk to you about one of those habits, vitamin C. Vitamin C isn't just a good supplement. It's one of the most powerful weapons against cancer, dementia, and aging. But its effectiveness varies dramatically depending on how you take it. One of the reasons I'm still actively treating patients in my 80s is because I've consistently taken vitamin C the right way. What I'm about to share may seem simple on the surface, but this one simple method can lower your risk of cancer, delay the onset of dementia, and slow down the aging process. More than any expensive supplement from the pharmacy, this habit could have a greater impact on your health. From this point on, I'll reveal the real key to taking vitamin C. This knowledge could be the key to protecting your body from cancer and dementia. So, how are you taking your vitamin C? One pill in the morning, on an empty stomach, right before bed? If so, what I share today might just change your health habits entirely. There was a woman in her 70s who frequently visited our clinic. Ms. Kim Young-hee used to take 1,000 milligrams of vitamin C as soon as she woke up each morning. "Doctor, I had to quit taking it. It gave me terrible stomach pain. I couldn't stand it." She had been taking it once a day on an empty stomach. Rather than helping, it just irritated her digestive system. Acidic vitamin C directly contacting an empty stomach only worsens the problem. Another patient, Mr. Park Sang-chul, also took 1,000 milligrams in the morning and said it had no effect. That's not surprising. Vitamin C stays in the body for only about 3 hours before it's excreted through urine. Taking it once a day simply isn't enough to be effective. These cases are extremely common. A recent patient of mine, Ms. Lee Suno-kei, age 82, had a similar story. She had been taking vitamin C for over 10 years, but still caught colds 3 times last winter. When I asked how she took it, it was once in the morning on an empty stomach. The reason it wasn't working was clear. You see, the 60 milligram daily dosage most people reference was established over 100 years ago, just enough to prevent scurvy. It has nothing to do with the needs of modern life. To prevent diseases like cancer or dementia, we need much more. Today's bodies are drastically different from those a century ago. Due to pollution, stress, and processed foods, we produce significantly more free radicals. Even just fine dust pollution is far worse than it was 20 years ago. These pollutants increase oxidative stress, damaging the DNA of our cells. That's why we need more antioxidants like vitamin C. There's another important point. Modern diets are nutritionally poor. Our soil contains fewer nutrients than before, and vitamins are destroyed during storage and distribution. So even if we eat the same amount of fruit, we absorb less vitamin C than people did 100 years ago. Vitamin C is water-soluble. It isn't stored in the body, it's rapidly expelled. Yet most people only take it once a day. That's like drinking 1 glass of water in the morning and staying thirsty all day. Have you ever stopped taking vitamin C due to stomach discomfort or because you didn't see results? If so, the issue might not be the vitamin itself, but how you're taking it. So I changed Ms. Kim Young-hee's regimen. I had her take 2,000 milligrams of powdered vitamin C 3 times a day, mixed slowly into water and consumed during meals. After just a week, her stomach issues were gone. After a month, her fatigue and digestive troubles improved. 2 months later, she told me, "I haven't caught a cold, and that usual aching in my body is completely gone." The same applied to Mr. Park Sang-chul. Once he began taking vitamin C 3 times a day, he told me after 3 months, "I think my memory has improved." He even mentioned that he now remembered small things he used to forget. In the case of Ms. Lee Sunoke, 82 years old, the change was even more dramatic. After adjusting her vitamin C routine, she didn't catch a single cold for 6 months. In my more than 40 years of medical practice, I've seen hundreds of such cases, the same vitamin C, but the results changed completely depending on how it was taken. Another patient, Mr. Kang Young-ho, aged 77, had been struggling with chronic fatigue. After adjusting his intake, he no longer needed a nap in the afternoon. "Now I stay energetic until the evening," he said. Again, same vitamin C, just a different method. Even the academic world now recognizes the importance of divided doses. According to a research team at Harvard Medical School, when vitamin C is taken in divided doses throughout the day, blood concentration levels remain more stable and the antioxidant effect lasts longer. That one simple change was enough to trigger a noticeable response in the body. How you take vitamin C truly matters. When taken properly, it can help suppress cancer cells, prevent dementia, and strengthen the immune system with impressive results. This is where today's video really begins: how vitamin C prevents cancer and dementia, and how you should take it to fully benefit. Please stay tuned to the end to learn how to maximize its potential. If this is your first visit to the 100-Year Wisdom channel, please consider subscribing and liking this video. I'll continue to share valuable health insights regularly, and if you're open to it, consider joining our membership. You'll receive early access to curated health information and never miss out on what truly matters. I'll do my best to help you live a long and healthy life. We share practical wisdom for living well beyond 100 years every week. Have you been trying to take all your vitamin C at once, or did you think it was best to take it on an empty stomach? Now let me walk you through the real method and the benefits it brings. 4 key points. First, cancer prevention. The secret to preventing stomach and colon cancer. Vitamin C is a major antioxidant that removes free radicals, which are a leading cause of cancer. Free radicals attack our cells and DNA, causing mutations. These mutated cells can develop into cancerous ones. According to the International Agency for Research on Cancer, free radicals are directly linked to over 15 types of cancer. The link is especially strong in stomach, colon, lung, liver, and breast cancers. Adequate intake of vitamin C blocks the formation of nitrosamines, carcinogens commonly found in additives, smoked foods, and pickled items. Vitamin C prevents these harmful compounds from forming in the stomach, making it effective in preventing stomach cancer. A study from Japan's National Cancer Center found that people with high vitamin C intake had a 25% lower incidence of stomach cancer compared to those with low intake. This effect was even more significant in people with high salt diets. Vitamin C also improves gut health by supporting beneficial intestinal bacteria. A healthier gut reduces chronic inflammation, which is crucial in preventing colon cancer. In fact, a study by the U.S. National Cancer Institute reported that those who consumed sufficient vitamin C had a 20% lower risk of developing colon cancer. It also helps immune cells retain their functionality and prevents cancer cells from escaping immune detection. Natural killer cells in the body are responsible for identifying and eliminating cancer cells. Vitamin C enhances the effectiveness of these immune cells, helping them remove threats more efficiently. One of my patients, Mr. Lee Jong-seok, aged 75, was found to have abnormalities in his stomach lining during an endoscopy. Along with prescribed medication, I had him take 2,000 milligrams of vitamin C 3 times a day for 6 months. At his follow-up, there was significant improvement in his stomach lining. "Doctor, I didn't expect vitamin C to be this effective," he said. Another patient, Ms. Choi Myung-ja, age 71, had polyps removed from her colon. To prevent recurrence, I recommended vitamin C 3 times a day. A year later, her follow-up examination showed no regrowth. While we can't attribute this solely to vitamin C, I've observed similar patterns in many patients. Here's a simple tip. Take vitamin C during meals, especially if you're eating meat or processed food. Consistency is key when it comes to cancer prevention, not just for a day or two, but for months, even years. If you have a family history of cancer or have received concerning results during checkups, I highly recommend you take vitamin C regularly. Keep in mind, vitamin C is not a cure for cancer. It's a nutrient that aids in prevention, and if you are undergoing cancer treatment, it's crucial that you consult your doctor before taking vitamin C, as it may interact with some chemotherapy drugs. When people ask, "Why did that person get cancer?" half the answer lies in free radicals. Vitamin C, one of the most powerful antioxidants, helps protect the body from them. What kind of efforts are you making to prevent cancer? Have you ever heard about the anti-cancer effects of vitamin C? Second, preventing dementia. The relationship between brain cells and vitamin C. Dementia is a disease where oxidative damage destroys brain cells. Although the brain makes up only 2% of our body weight, it uses about 20% of our oxygen. This results in a high production of free radicals, which in turn damage the brain cells. Vitamin C exists in the highest concentration within the brain. This is no coincidence. The brain concentrates vitamin C to protect itself from oxidative stress. In other words, if you lack vitamin C, the brain's defenses weaken. A study from Oxford University found that the concentration of vitamin C in the brain is over 10 times higher than in other organs, particularly in areas like the hippocampus, which is crucial for memory formation. Vitamin C levels are especially high. This provides strong evidence that vitamin C plays a vital role in brain health and memory. According to research from Johns Hopkins University in the United States, elderly individuals with high blood levels of vitamin C had a lower incidence of Alzheimer's disease. In a 16-year study tracking 4,000 seniors over the age of 65, those with high vitamin C intake had a 30% lower risk of developing Alzheimer's. Vitamin C also helps inhibit the accumulation of beta-amyloid protein, which slows the progression of Alzheimer's disease. Beta-amyloid is a toxic protein that interferes with communication between nerve cells and is commonly found in the brains of Alzheimer's patients. Vitamin C also reduces inflammation in the brain. Inflammation is one of the major causes of dementia. Vitamin C suppresses the production of cytokines, which are substances that cause inflammation, thereby protecting the brain. Furthermore, vitamin C is essential for the production of neurotransmitters like dopamine and norepinephrine. These neurotransmitters are crucial for mood, cognitive function, and concentration. One of my patients, Ms. Kim Youngja, age 82, was diagnosed with mild cognitive impairment. Alongside medication, I recommended she take vitamin C 3 times a day. A year later, her cognitive function test scores remained stable. Normally, these scores worsen over time, so the fact that hers didn't decline was a significant achievement. Her daughter expressed relief, saying she was grateful her mother's memory hadn't deteriorated further. Another patient, Mr. Lee Young-soo, age 79, came in with early symptoms of cognitive decline. After starting medication and adjusting his vitamin C regimen, his mini mental state examination score improved by 3.1 points after 8 months. "Now I remember names I used to forget," he told me. As a practical tip, I recommend taking vitamin C along with omega-3 fatty acids, which are also excellent for brain health. Studies show that taking both vitamin C and omega-3 together produces better cognitive improvements than taking either alone. Combining vitamin C with cognitive activities like puzzles, reading, or learning new things further enhances its preventative effects. In a study from the University of Tokyo, groups that combined antioxidant intake with cognitive training had the lowest rates of dementia onset. Of course, dementia can have multiple causes, so vitamin C alone cannot completely prevent it. But it is one of the key factors that can significantly reduce your risk. As memory begins to fade and senses dull with age, prevention becomes more important than ever. Because once dementia starts, it cannot be reversed. Vitamin C is one of the easiest and safest ways to prevent cognitive decline. It has minimal side effects and can be taken daily without difficulty. Do you or someone in your family worry about memory loss? Why not begin protecting your brain with vitamin C? Third, the proper method, 6,000 milligrams per day, divided between meals. Vitamin C's absorption rate drops after 3 hours. That's why taking a large amount all at once is meaningless. If you take 1,000 milligrams in a single dose, most of it will be excreted through urine, and only a small fraction will actually be utilized by the body. According to a study conducted by the University of Cambridge in the UK, when 1,000 milligrams of vitamin C is taken at once, only about 20% is absorbed by the body, the rest is expelled. However, if you divide that same 1,000 milligrams into 5 doses of 200 milligrams each, the absorption rate increases to over 70%. That's why I recommend taking 2,000 milligrams of vitamin C between breakfast, lunch, and dinner, for a total of 6,000 milligrams per day. The powdered form is best absorbed, though tablets and drinks are also acceptable. What matters most is dividing the intake. Taking it during a meal means you should drink it about 5 minutes after starting to eat. At that point, there's food in the stomach, which minimizes irritation to the gastric lining and improves vitamin C absorption. A study conducted at the University of Sydney in Australia found that when vitamin C was taken with food, its absorption rate was 15% higher compared to taking it on an empty stomach. Furthermore, the incidence of gastrointestinal side effects was 68% lower. Please don't take vitamin C on an empty stomach. It can cause stomach irritation. Vitamin C is ascorbic acid, and introducing acid into an empty stomach naturally stimulates the gastric lining, often causing discomfort. One of my patients, Mr. Park Young-soo, age 67, initially took 1,000 milligrams once a day. After switching to 3 divided doses with meals, as I advised, he said, "After 2 months, I began feeling a vitality I hadn't experienced before." Another patient, Ms. Han Ji-young, aged 73, had stopped taking vitamin C because of stomach pain when taking it on an empty stomach. Once she started taking it during meals, she was able to continue without discomfort. 6 months later, she told me, "My skin tone has brightened, and even small cuts heal faster now." Powdered vitamin C is ideal because it absorbs quickly and is gentler on the stomach. When mixed in water and sipped slowly, it spreads more evenly across the gastric lining, reducing irritation. Tablets are less absorbent than powder but are convenient to carry and useful when going out. Liposomal vitamin C, which is coated in lipids, causes less stomach irritation and is absorbed well. but it's expensive and often doesn't reach the intestines. Here's a practical tip. Starting with 6,000 milligrams may feel overwhelming, so begin with 1,000 milligrams 3 times a day. Increase by 500 milligrams each week. After 3 weeks, you'll reach 6,000 milligrams per day. Keep a container of powdered vitamin C on your dining table so you can remember to take it during meals. When going out, carry small pre-portioned packs in your bag. It's a convenient way to stay consistent. I've recommended this method to my patients for over 40 years, and I've witnessed countless people experience real changes in their health simply by applying this straightforward practice. Even more than expensive supplements from the pharmacy, this method alone can deliver greater results. How much vitamin C are you currently taking each day, and how are you taking it? Why not try the divided method starting today? Fourth, precautions. Diarrhea, stomach irritation, and kidney stones. Start slowly. Begin with 2,000 milligrams per day, then gradually increase to 6,000 milligrams as your body adapts. Taking large amounts suddenly can lead to diarrhea, as the intestines aren't ready for it. Vitamin C has osmotic properties. It draws water into the intestines. If you take too much at once, excess water enters, causing diarrhea. This is called osmotic diarrhea. One of my patients, Mr. Kang Byung-ho, age 78, experienced diarrhea even with just 2,000 milligrams at first. So he started with 500 milligrams, gradually increasing by 500 milligrams every 2 weeks. Eventually, his body adapted, and now he takes 6,000 milligrams daily with no issues. I nearly gave up on vitamin C because of the diarrhea, he said, but once I increased the dose slowly, I was fine. If you do experience diarrhea, reduce the dose. Also, increasing your water intake can prevent kidney stones. Drinking over 2 liters of water per day significantly reduces the risk of vitamin C-related kidney stones. In fact, there are many misconceptions about vitamin C and kidney stones. A large-scale study from Harvard Medical School found no clear causal link between vitamin C intake and the development of kidney stones. Instead, the more important factor was hydration. Taking magnesium alongside vitamin C further reduces the risk of kidney stones. Magnesium helps prevent the crystallization of uric acid. A daily dose of 400 to 500 milligrams of magnesium taken with vitamin C can be beneficial. When taking high doses of vitamin C over long periods, there are a few important precautions to keep in mind. Vitamin C increases iron absorption, so people with hemochromatosis, a condition where too much iron accumulates in the body, should be cautious. Individuals with certain deficiencies should also consult their physician before starting supplementation. While vitamin C helps enhance iron absorption, excess iron can actually reduce the effectiveness of vitamin C. For that reason, it's best to take iron supplements and vitamin C at least 2 hours apart. If you're currently taking medication for high blood pressure, anticoagulants, or undergoing cancer treatment, it's especially important to consult your doctor before taking high doses of vitamin C. Some drugs can interact with it. For instance, anticoagulants like warfarin may behave differently when combined with vitamin C. High doses of vitamin C can also affect the results of some lab tests. If you're undergoing a medical exam, let your healthcare provider know you're taking vitamin C to ensure accurate results. One of my patients, Mr. Lee Jung-soo, age 76, experienced diarrhea when taking just 2,000 milligrams of vitamin C. So, he began with 1,000 milligrams, gradually increasing the dose by 500 milligrams every 2 weeks. Eventually, his body adjusted, and now he tolerates 6,000 milligrams a day without issue. Increasing the dose slowly helped my body adapt. Now, I wake up in the morning with so much more ease, he said. When it comes to vitamin C, how you take it is more important than worrying about side effects. If you follow the proper method, the risk of adverse effects is minimal and the benefits are maximized. Have any of you experienced side effects from vitamin C? If so, why not try starting slowly and giving your body time to adjust? Vitamin C isn't a miracle supplement that works just by taking it. It becomes a true ally when taken correctly. In my 40 years of internal medicine practice, I've seen countless patients experience remarkable improvements just by changing their approach to vitamin C. This method is especially critical for those over the age of 60, when the risks of cancer and dementia increase significantly. In fact, I myself am a beneficiary of this method. 30 years ago, when I was 50, I suffered from severe fatigue and frequent colds. I came across research papers from abroad explaining the divided dosing method for vitamin C and decided to try it myself. Since then, I've remained active, free of major illness, and continue to practice medicine today. You too can begin now. Age is just a number. Whether you're in your 60s, 70s, or even 80s, it's not too late to feel the difference. The body responds positively to good habits, regardless of age. When it comes to preventing cancer and dementia, the key is early action. Prevention needs to begin long before symptoms appear, and vitamin C is one of the safest and most effective tools to support that prevention. The average life expectancy in South Korea has surpassed 83 years, but the average healthy life expectancy is only 64. The goal is not merely to live longer, but to live healthier for longer. I've treated thousands of patients over the years, and those who have lived well into their 90s all had one thing in common. They maintained small but consistent healthy habits. Taking vitamin C properly was one of them. To summarize, take 2,000 milligrams of vitamin C 3 times a day between meals for a total of 6,000 milligrams. If possible, use powdered form. Start with smaller doses and gradually increase. Take it with plenty of water. Just by doing this, you can protect your body from cancer, dementia, and aging. The benefits of vitamin C are scientifically proven, yet so many people miss out on them simply because they don't know the correct way to take it. People often ask me, "Doctor, is this really enough?" I tell them there is no such thing as enough, but this is one of the most fundamental and important steps. Exercise, diet, and stress management are all essential, but vitamin C is one of the easiest health habits you can adopt. The reason I can still see patients at age 80 and maintain my health is thanks to these small habits. Even now, I take vitamin C 3 times a day during meals. It's become second nature. Vitamin C isn't stored in the body. You need to take it in small amounts throughout the day so it can perform its proper function. Cancer and dementia don't suddenly appear. They develop gradually over decades. That's why prevention is so crucial. And vitamin C, as a safe and effective option, can play a key role in daily prevention. Some people say, "It's already too late for me." But based on my 40 years of experience, I can say this with confidence: it is never too late. I've seen many people who changed their habits at age 85 and went on to live healthy lives into their 90s. This very moment is the best time to start. Why not begin tomorrow morning by changing just one thing, adding a glass of vitamin C during breakfast? You can start changing your health habits right now. It doesn't need to be complicated. Begin by placing a container of powdered vitamin C on your dining table. Your body will respond first. Today's health begins with today's habits, and even if you start now, you're not too late. Health isn't built overnight. It is formed by the accumulation of small habits over time, and those habits become the foundation for living well into your hundreds. Little secrets like this, ones that hospitals rarely teach, can change your life. If you make the effort to practice them consistently, little by little each day, you'll eventually find yourself enjoying a vibrant and healthy later life. In the next video, I'll share 3 nutrients that, when taken together with vitamin C, double its effectiveness. Did you know that combining vitamin C with zinc can double your immune system's strength? Make sure to watch the next episode. We support your journey toward a healthy 100 years. Thank you.